Meanwhile, House Democrats vote to expand Obamacare as President Trump argues in court to do away with it. Joining us again are Congressman Rodney Davis, Congresswoman Jan Schakowsky, and Congressman Raja Krishnamoorthi. I want to continue our discussion on COVID-19. Congresswoman Schakowsky, health experts say there's a short window to get this recent surge under control. Do you believe the country can get this under control and bend that curve again?
You know, to say that we're doing all we can couldn't be further from the truth. We have lacked national leadership to set clear, not just guidelines, but to require certain behaviors, to help the states who have been left totally on their own with testing and just handling the virus, especially in nursing homes. And we've actually been worse than no help at all, because the president has been signaling the opposite of what we should be doing and holding rallies. I am very worried, even in Illinois and in Chicago. I wasn't home this weekend. I was here because we've been having so many meetings in Washington. But I understand that the bars were full, that people were on top of each other, no social distancing, or at least in some places, and that people were not wearing masks. And I want to tell you, unless we hear different and we get some services provided by the federal government, I really don't know how long this would take. And to say we're doing well, compare us to every other country, and we're just not doing well. The United States is doing worse than any of the rich countries in the world.
It does appear there are bipartisan calls now for wearing masks. Congressman Krishnamoorthi, should there be another round of stimulus to help people affected by the economy right now?
Yes, I think so. I think that there has to be help for families who are really suffering right now. There has to be help for businesses. The PPP program was a start. The Paycheck Protection Program was a start, but there were problems, and businesses continue to need relief because demand for their goods and services is not near their pre-pandemic levels. And then finally, we need a lot more assistance for testing and contact tracing and even personal protective equipment, which is still in shortage in numerous parts of the country. And we need regulation of the testing markets. I'm chairman of the subcommittee on economic and consumer policy, and we led an investigation of the antibody testing market. Unfortunately, hundreds of junk tests have flooded the market. Millions of people are taking these antibody tests, and we did pressure the FDA to regulate this market, but they're going too slowly. And unfortunately, it's being handled with the type of incompetence that the rest of the response to the pandemic has unfortunately modeled. So we have a long ways to go.
I want to move on to health care debates right now. In the midst of this pandemic, House Democrats just approved an expansion of Obamacare while the Trump administration argues before the Supreme Court to do away with it. Let's hear what House Speaker Nancy Pelosi had to say.
We are enhancing the Affordable Care Act. The president is overturning it at a time when we have over 125,000 Americans who have died.
Congressman Davis, the president has promised an alternative, has promised to keep coverage of pre-existing conditions, but is there any serious proposal to cover folks with pre-existing conditions if Obamacare is done away with?
Well, I love how my colleagues like to rewrite history. We had a proposal. It passed the House of Representatives in the last Congress, would have lowered premiums, would have protected everybody with pre-existing condition coverage. And that pre-existing condition coverage is personal to me. My wife's a 21-year cancer survivor. And that's something that we Republicans put into the bill that was passed that 0 Democrats voted for. As a matter of fact, it failed by 1 vote in the Senate. So we put forth our version. But the Democrats run the House, and they talked about fixing our broken healthcare system that's still leaving 60 million Americans behind. And instead of actually sitting down and passing common sense bills like my bill that would open up the ACA for 30 days, but also extend COBRA coverage subsidies so that families ravaged by COVID can still keep the doctors that they're used to working with if they're going through similar situations that my wife did 21 years ago. But instead of calling a bill like that, they put a messaging bill on the floor that everybody knows has 0 chance of becoming law, just to fulfill a campaign promise, because in over a year and a half, they have yet to do anything to help those 60 million Americans that don't have coverage or can't afford to use the coverage that they have.
Congressman Schakowsky, is there some sort of compromise with Republicans on expansion of health care? As I mentioned, the House Democrats did pass an expansion of some tenets of Obamacare.
Yeah, I have never heard such misinformation about this. Everyone knows that the Republicans have voted like 60 times to get rid of the Affordable Care Act, which actually did not only protect people with pre-existing conditions, kept our kids on the family policy, have made prescription drugs more affordable. That's what our new bill does. That is just ridiculous. It is the White House that has gone to the Supreme Court and said, just get rid of it. At the same time as the Democrats are working every day and have been through the Obama administration and through the Trump administration to expand the benefits. Did you know that in Illinois, women of color are 7 times more likely to die in childbirth-related instances? And so we have in this bill a plan to address these kinds of disparities. They should just vote for this bill.
I want to move on to police reform quickly. Congressman Krishnamoorthi, a Republican-led effort in the Senate, a Democratic-led effort in the House. In your mind, what is wrong with the effort in the Senate?
Well, unfortunately, although I commend Senator Tim Scott for trying to do something with regard to the police reform issue, it was woefully inadequate in the end, because it doesn't do what is required to meet the magnitude of the problem. Our House measure bans chokeholds, ends no-knock warrants. It also establishes a national registry for police misconduct, and it requires national heightened standards for police training.
And Congress, I'm sorry to cut you off there. Congressman Rodney Davis, in the few seconds we have left, in your mind, what is wrong with the House-led proposal?
Well, it's a travesty, first of all, that Tim Scott's bill wasn't even allowed to be debated in the Senate. This is an African-American Republican senator who's faced racial profiling, and the Democrats, including our 2 senators, wouldn't even allow that bill to be debated. That's frustrating. There's room for compromise, but let's just not go in and begin to ban police techniques and also qualified immunity at a time where we can't sit down and come up with bipartisan solutions. There was no attempt to try and come together in a bipartisan way to actually address about 80% of the issues that we all agree on that need to be addressed when it comes to data collection. But for the Democrats to say we've got to get rid of qualified immunity, otherwise bad cops will be able to do the same thing that happened to George Floyd, that's wrong. That's why Derek Chauvin, the man who murdered George Floyd, is being charged with murder.
My thanks to Congressman Rodney Davis, Congresswoman Jan Schakowsky, and Congressman Raja Krishnamoorthi.